The Health Minister Norman Lamb has praised Mersey Care for its pioneering work in reducing the number of restraining incidents on patients in some of its mental health wards. During a morning spent with the Trust, Mr Lamb met staff who are leading the No Force First pilot scheme. He was told that since the initiative was launched 18 months ago, the number of staff being injured during restraints and taking time off work as a result has fallen dramatically. Service users also explained how they felt much safer knowing that restraint procedures would be avoided if at all possible.
So your demonstration of how it can be different and how you can escape from this culture is just critical, because it's not me just arguing the case from a sort of theoretical point of view. You're demonstrating on the ground. There should be no place for sort of deliberate face-down restraint in a modern mental health service.
Many people just say it's not possible, but you're demonstrating already dramatic reductions in the use of restraint. You're ending the use of deliberate face-down restraint, and we're seeing dramatic reductions in staff sickness absence, people going away on sick leave because they've been injured in restraining patients. That's come down from over 500 to something under 20. This is incredible over an 18-month period. And of course you're making a massive difference to people's lives. And when you hear a service user talk about the trauma that they go through when they experience restraint, and how often it brings back memories of possibly sexual abuse as a child. You know, if you're a woman and you've got men on top of you, the awful memories that brings back. Just imagine what that does to your state of anxiety and the way that you'll then respond in the future. So everything escalates. So this very different approach with a focus on positive culture, positive environment, avoiding problems occurring in the first place, getting the staff behaving differently, I think it's fantastic.
Mr Lamb also heard of another initiative being launched by Mersey Care at the end of June. The streetcar project will see nurses and police officers working together in cars, touring the streets of Liverpool, looking to help in incidents where mental health could be a factor.
Well, I think what Mersey Care are doing here, both on the positive environment in wards and bringing an end to the use of restraint, and their work on liaison on diversion, and indeed the streetcar initiative, I want this to become the norm across the country. This is a modern mental health service that Mersey Care is demonstrating can work and can make a massive difference to people's lives, and if it can happen here, it can happen anywhere.
Later, Mr Lamb was shown how construction work is progressing on Mersey Care's new £25 million mental health hospital being built on the former site of Walton Hospital. The state-of-the-art facility is due to open early next year.